stressed out and burned out. Michigan nurses say they're on the edge.
As so many say that COVID-19 infections and hospitalization rates keep rising, and fewer nurses are hanging around to care for patients. Tonight, News Channel 3 investigative reporter Mike Kravchik tells us how it could impact care for everyone.
Experts said the nursing shortage could have potentially deadly consequences. Pandemic burnout and retirement are leading to staff shortages at hospitals as the state faces a fourth wave of COVID-19. Nursing professionals say it's becoming a dangerous time for healthcare workers and patients. 18 months into the COVID-19 pandemic, each passing day more stressful for Ascension Borgess Hospital nurse Jamie Brown. She's also the head of the Michigan Nurses Association.
I've seen more death in the last 18 months than I have in my 18 years of nursing.
The Michigan Hospital Association says it's seen a 16% increase in hospital emergency department visits compared to the same period in 2019 before the pandemic.
A lot of people go to nursing school thinking it's so pretty.
Drew Root is a nurse in Bronson Battle Creek Hospital's COVID unit. She started last month.
I feel like some people feel like they're just stuck in a rut when they're in the same unit and seeing the same, death after death after death, and it just gets overwhelming.
A recent National Healthcare Retention and Nursing Staffing report shows 93% of nurses who left hospitals during the pandemic either retired or quit.
We actually had emerging data that nurses were expressing high rates of burnout before the pandemic.
Christopher Fries is a nursing professor at the University of Michigan. Fries's research shows patients have a greater chance of dying when their nurses have more patients to care for.
It's a very dangerous time for nurses and other healthcare workers.
He says the pandemic is deepening existing staffing shortages felt for years at hospitals across the state.
I'm deeply worried by the trends that we're seeing in the state and in the nation.
To close staffing shortages, he says more Michigan hospitals are signing more travel nurses. They work on short-term contracts, and some agencies can pay upwards of $5,000 a week.
There's a 6-month contract out there right now for over $100,000.
Brown estimates right now about 100 of the 600 nurses at Ascension Borgess are travel nurses.
Nurses with more experience are leaving the hospital to go to better paying jobs and to travel.
It's raising concern over what happens when those traveling nurses leave local hospitals.
I worry about communities where hospitals may not have the financial means to continue this for a long period of time, and they don't have a local pool of nurses to attract.
1 month into the job, and Root says the profession near and dear to her heart is already taking a toll.
Emotionally, it's very overwhelming. It's something that, you turn off the radio when you go home and you just cry all the way home.
Earlier this year, state lawmakers introduced legislation that would set maximum patient ratios for nurses in order to lighten their workload. Right now, that bill remains stuck in a House committee, and there's no indication lawmakers will vote on it.
Doctors say there's yet another respiratory virus on top of COVID-19 that's impacting children and causing Michigan hospital beds to fill up fast. News Channel 3's Andrew Feather is joining us in studio now to tell us about a surge in RSV. To tell us, Andrew, what that is and what it could mean for our kids.
Yes, Andy, doctors tell me this is extremely early to see any sort of surge in RSV, leading to concerns it could get even worse during its typical season in a couple months. Now, this, of course, piling more on hospitals already stretched thin from the COVID-19 pandemic. Andrea Finnegan says she can clearly remember her fear, rushing her 5-month-old Sophie to the emergency room 2 weeks ago.
Walking into Sophie's room, listening to her breathe, watching her struggle was terrifying to see as a mom.
A doctor saying Sophie and her 2.5-year-old sister Tegan both had respiratory syncytial virus, or RSV.
I felt completely helpless and like I couldn't do anything to make her feel better.
Sophie's and Tegan's cases are far from alone. Dr. Rosemary Olivero, a pediatric infectious disease physician at Helen DeVos Children's Hospital in Grand Rapids, says cases of RSV are on the rise. She says in July and August, about 60 children were admitted with RSV, up from about 1 or 2 during the same period during a typical year.
to see as many as we've seen July and August is really unheard of.
Olivero says RSV is especially dangerous in young children because it inflames airways, making it harder to breathe. In young children and infants, airways are smaller and more easily blocked, leading to more serious cases. She says hospitals don't typically start seeing RSV cases until late fall or early winter.
We are concerned that if the trend continues as it currently is, that we'll have even more cases. Next month could be even busier with extremely high numbers in the intensive care unit and on the pediatric floors.
Olivero says the surge is likely due to people relaxing COVID-19 mitigation measures, which helped slow the spread of most viruses. Finnegan says her daughters are doing well.
Sophie still has a little bit of a residual cough, but she's sounding better.
But hopes the surge slows so other parents don't have to experience the same situation. Experts say parents should watch out for symptoms including coughing and trouble breathing. If those symptoms persist, you should visit your pediatrician.
A resolution on whether to rescind the K-6 school mask mandate in Kalamazoo County moves forward.
Yeah, tonight was the first reading of that resolution, and enough Kalamazoo County commissioners agreed to put it up for a vote. Tonight, News Channel 3's Chris Hugh is joining us in studio to explain what's next. Chris.
Yeah, Andy, Kalamazoo County Commissioners will vote on the resolution in 2 weeks. But keep in mind, even Commissioner Roger Tenier introduced it. But keep in mind, even if it passes this resolution, it can only ask the county health department to rescind the mask mandate. The document does not have the power to require it. Still, people who want the mask mandate gone hope the resolution makes a statement. Caller after caller.
I will never stop advocating for my children's well-being.
Speaking up.
This is a choice that is best made by parents.
About masking in school.
I don't think you would want me to come into your house and tell you how to raise your kids.
They chimed in during Tuesday's Kalamazoo County Commission meeting, urging commissioners to support a resolution rescinding the K-6 school mask mandate.
I'm praying that you will vote in favor of this resolution.
Tuesday's meeting was the first reading.
Therefore, be it further resolved that a copy of this resolution be sent to Governor Gretchen Whitmer.
Afterward, there was enough consensus to move the resolution forward.
6 by my number will move it.
Although Board of Commissioners Chair Tracy Hall raised her hand, it doesn't mean she supports the resolution. It just means she's in favor of putting it up for a vote in 2 weeks. Hall believes the school mask mandate can help bring COVID cases down, which is why she supports another resolution in support of Kalamazoo County Health Officer Jim Rutherford.
Also, I respect him because he's the expert in this field. He has experts he works with in public health.
Mike Quinn is the commissioner who introduced the resolution to support Rutherford.
The hyperbolic exaggerations that Director Rutherford's attackers are throwing, this needs to be stopped. This is not just misinformation. This is outright lies.
Commissioner Jen Strebs supports Rutherford as well.
There's been deep analysis about what measures make the most sense to help the community stay safe. And Director Rutherford has put in his time and his energy and his expertise on that.
As for that resolution to support Rutherford, tonight was the second reading, and just a short time ago, the Kalamazoo County Board of Commissioners passed it by a vote of 6-5.